All right. Hello and welcome everyone to today's Gift of Time webinar. My name is Jacob Borkover here on the webinar team at Rectangle Health, and just want to thank everyone for taking time out of their days here to be with us. We've got a great presentation with Matt and Brandon talking all things reimbursements, Zealous, Rectangle Health, and a bunch of other stuff. So really great presentation and appreciate everyone being here. So before we get into things, just a few quick housekeeping items here. We are going to be sending out a link to the recording and the slides in a follow-up email within 24 hours of the presentation. So be on the lookout in your email inbox for that, and we'll send all those resources your way. We are going to have some polling questions throughout the presentation. We do ask that you participate and are attentive so that we can better engage with you and learn a little bit more about who we have with us here today on the presentation. So at the end of the webinar, we're going to have a brief survey pop up. It's just a few questions. Please fill that out so we can continue to provide you with the best webinars possible and so we can give great feedback to our speakers. I'm going to put a link to our next webinar in the chat as well. We've got a great OSHA presentation coming up next Thursday. It's 1.5 CE credits, really great course, all things you need to know about OSHA. So I'm going to have that link in the chat for you in case that is of interest to you or anyone else in your practice. If you have any questions at all today throughout the presentation, don't hesitate to ask. I'll be behind the scenes answering some questions, and then we'll also have a Q&A segment at the end. So we'll be able to ask Matt and Brandon any questions that pop up throughout the course of the webinar that you may have. And then, of course, you can always email us as well at webinar@rectanglehealth.com, and we'll get to your questions as soon as we can. So I'm going to go over a quick agenda of what we have in store here for us today. We're going to start off with a brief introduction, talk a little bit about Rectangle Health, who we are, what we do, how Bridge Payments simplifies the payment process, and then we're going to get into talking a little bit about Zealous. So what is Zealous? How do they help? How do Zealous and Rectangle Health help your practice process insurance reimbursements? And then we're going to go through straight through processing, how that's an absolute game changer, and then we're going to do a little bit of Q&A. And then really excited to be having an Apple Watch giveaway today. So we're going to be giving out 2 Apple Watches. One is going to go to one lucky respondent who is interacting with our polling questions throughout the presentation. So just another reminder for you to answer those polling questions. You'll be automatically entered to win one of the 2 Apple Watches. And then our other Apple Watch is going to go to someone who fills out a demo with us. So if you like what you hear today, and you want to learn more from our team, fill out that demo form and attend a demo before June 28th, and you're going to be entered to win an Apple Watch, because today is all about the gift of time and putting time back in your days. So what better to give away than an Apple Watch? And so to start us off here, we just want to get to know a little bit more about who we're chatting with. So we're going to start off with a quick polling question. I'm going to launch this here. All right. Are you the individual responsible for managing claim reimbursements for your practice? Yes, no, or I have some responsibilities. All right, give everyone a few more seconds. All right, looks like we've got 80% participated. Looks like 60% of you said yes, that's awesome. 15% no, and then 25% said I have some claim responsibilities. So really great to hear that. And then with that, I am very excited to introduce our speakers for today's presentation. Brandon McGauley is a Director of Strategic Vendor and Partner Management for Zealous. He has over 5 years of expertise in multi-channel marketing with a keen focus on product implementation and project management. In his role at Zealous, he drives seamless collaborations, ensuring Zealous remains at the forefront of innovation in healthcare technology. And we have Matt Bernier, who's the Bridge Payments Product Manager at Rectangle Health. Matt is an experienced product manager who has been in healthcare software for over 20 years, with 7 years in product management specifically. Matt has delivered value on the provider and payer side with new features on payments, claim adjudication, and clearinghouse platforms. So with that, I'm going to send it into you, Matt. Take it away.
Thank you, Jacob. Thank you for that great introduction. Yeah, Rectangle Health. I'm the product manager, and we've been in business for over 30 years on the healthcare finance technology side. Rectangle Health is a trusted partner to over 40,000 healthcare providers, and we process somewhere around $9 to $10 billion of patient payments annually. So our platform is called Practice Management Bridge, which is a bridge from your practice management system to the patient or provider experience. And it's an all-in-one platform that contains all three solutions that you see on the screen there. The best part is you can use it across the entire patient journey, which we'll be talking a lot today, and share data with any practice management system. It's completely scalable, so it grows as you grow. And we have decades of success and experience helping thousands of providers optimize their tech stack and provide a return on investment. Said another way, it simplifies the business side of healthcare, which is our mission at Rectangle Health. All of our solutions center around that because we want to give time back to the practices. Let our solutions handle the business or the admin tasks while you focus on the healthcare, while you focus on patient care. Our solutions can help move the patient through the journey seamlessly and in an automated fashion, as well as help you, the practice, navigate that same journey, that revenue cycle journey. And we can meet the patient where they are and automate the process with the digital solutions we're going to talk about today. Of course, our solutions are HIPAA, PCI compliant, and high trust certified. And just to touch on the solutions on the screen there, Bridge Engagement. This is our solution to keep your schedule full, automate reminders, keep patients connected through their care journey. And then we have Bridge Compliance, which is, a solution to help you navigate HIPAA and OSHA compliance. Everything from taking the HIPAA assessment to getting your staff the training they need to maintain that compliance. And then the last one we're going to talk about, which is the one we're going to talk about mostly today, is Bridge Payments. So if you go to the next slide, we have a slide dedicated to Bridge Payments, which is the comprehensive digital payment solution we have to collect patient payments, improve the billing process, grow revenue quickly, and give the patient convenient ways to pay. And of course, today, we will show you in our partnership with Zelis straight through processing, where we automate the process of processing insurance payments, which is a great example of two companies who are leaders in what they do, coming together to synergize to make a solution that really benefits you and gives you even more time back. So now I'm going to go through a couple slides that kind of talk about Bridge Payments a little deeper and their value props. So let's go to the next slide. Oh, first we have a screenshot, just really briefly. We have a real clean user experience design. It's very intuitive. And on the left-hand side, you can easily navigate between all the modules we're going to talk about on the next slides. And we have a Wobble navigation at the top left that you can seamlessly go through the three solutions I mentioned before: Bridge Compliance, Bridge Engagement, and Bridge Payments. So let's go to the next slide. So improving practice profitability. So you can see there on the screen, we have some bullet points about how we help you with your profitability. It's really about meeting the patient where they are. Like I said before, as they go through their journey, they want to leave a card on file. You can do that securely in an encrypted manner in our system. So that's the vault that you see there on the right-hand side. And then texting to pay, you can send your patients a link to remit their payment, and as well as accept online payments, either through a link to your website, through a QR code, or through that text to pay. Like it says there, it's available 24 hours a day. So it's really about getting that money in at a time that's convenient for your patient. So on the next slide, we kind of talk about that patient experience a little deeper, where it's really about meeting them where they are. I know I've said that before. I'm going to probably say it 3 or 4 more times. So getting in their hands the solutions that are digitized and automated. As you see there, customizable messages. So we can send the patient, an individual text. We can bulk text all the patients, their balances in an automated fashion. We can capture their registration forms in an automated digital fashion. So before they even get to the office, you can already have that patient intake form ready. Text to pay, you can obviously, again, text them, whatever balances are due, and you can securely and safely store their credit card information in the vault. I love using the vault. I use the vault where I get my hair cut. I use my vault at the dentist office. When they say, can we just check you out using your credit card ending in 1234? I always say absolutely. The only difference is where I get my hair cut, they ask for a tip. Thankfully, they don't do that at my dentist. If they do, I'd probably have to find a new dentist. But lastly, we also have flexible payment plans. So you can give your patients the options to pay over time through a recurring payment plan. And then for patients that need even more financing, we do have a patient financing module available. So, contact us if that sounds like something you would like to offer to your patients. But again, it's all about meeting the patients where they are and making things as seamless and convenient for them as possible. So let's go to the next slide where we talk about, what we're here to talk about today, which is saving time and increasing efficiency. So, when we get that patient payment, we can automatically post it to the patient ledger, whether that's during the swipe or, when we're collecting that balance through the text to pay site. Those easy posts save you a lot of time. Contactless capabilities. So letting the patient pay their bill in a contactless manner, again, saves a lot of time, increases efficiency. You got Apple Pay, Google Pay for touch-free. They can also scan a QR code and pay on their phone. So we have many different ways that we can help you provide that to the patient. Of course, the vault, as we said before, you can use your card on file when you're checking out. You can use that card on file to set up a recurring payment plan too. And then the digital payment forms or patient registration forms. So we can get those patient forms in without having to spend too much time on that. And as you can see on the left-hand side, all of the benefits of using these tools that are in the bridge payment system. Let's go to the next slide, where I'm going to hand this over to Brandon to talk about Zealous for a few minutes.
Alrighty. Thank you, Matt. And good morning or afternoon, everyone, depending on where you're calling in from. My name is Brandon McGauley. I'm Director of Strategic Partnerships here with Zealous. I'm on the payments product team and been with the organization for a little over 11 years now. Excited for the opportunity today to talk through the technology we put together in partnership with Rectangle Health. But before we kind of jump into those challenges and the benefit add of what we built, I just want to give a little background on Zealous. Essentially starting with our primary mission, right, as an organization, and that is to modernize the healthcare experience for all. And what does that mean exactly? So Zealous is at its core is a technology company, right? And the platform we've built, we aim to bridge the gap in the healthcare financial system from payer to provider to member. And we do that in a variety of ways and services that we could kind of categorize into three separate structures, right? So from pricing to payment to empowerment. From the pricing component, that's where we work with our payer clients to establish their provider networks. We have claims editing and bill review software and out-of-network services that we can provide to those payer partners. Then we have our payment platform, which is referenced as Zealous Advanced Payment Platform, and this is where we're able to ingest that data in from the payer, whether it's through 835 or a proprietary format, and create digital transactions to distribute to both providers and members along with the appropriate EOB or EOP data that accompany the transaction. And then from the empowerment perspective, we have a communication service where in our St. Louis facility, we are able to print and mail EOB communications, ID, excuse me, ID cards to over 110 million members each year. So with each of these services, again, we're ingesting a lot of data, gathering multiple insights around each of the step of the healthcare cycle, and being able to offer those unique tools and services to help better that process, not just for one segment, but for everybody. A little bit about some of the numbers and background here. Again, we process about $220 billion in payments annually. $110 billion in claims that run through our pricing and editing software. And then, as mentioned earlier, we are working with over 100 million members each year, again, receiving those EOB claims communications and our ID cards. Next slide, please. Again, I'm excited today again to talk with Matt and everyone around our software that we've put together with straight-through processing. And again, wanted to first highlight what we see as a challenge today particularly in the payments process, right? So I spoke about those three categories that Zealous handles in the healthcare system. but primarily want to focus on payments today. And the challenges that we see primarily with check and printed card or even fax card modalities are the manual and time-consuming process that it takes not only to print and send that card, but then receive that card, open it up, process it, and then post it to your practice management system, right? So each of these steps obviously adds to administrative time. It burdens the revenue cycle process on your practices, right? So with the process that we built and the software that we built with Rectangle, our goal was to eliminate those, or as much as possible, to make your revenue cycle management running much more efficiently each day, right? So if you think about it as an example, if you get a check payment today, you have to have an individual obviously get that piece of mail, open up the mail, get the check, take a snapshot of the check either with a mobile phone or actually take it to the bank to present it. And the bank would then have to take maybe another 1 to 3 business days to actually post the payment. Now, it might say that the funds are processing in your statement, but again, the bank has to clear that payment. So it's delaying that time to receivables. And we really see these as challenges that are facing provider practices today, because it's not only delaying your time to actually receive the money, but it's also adding an additional administrative cost to that process. Next slide, please. All righty, Jacob, looks like we have our first, actually second polling question. If you want to go ahead and kick that off.
Let's do it. All right. How does your practice currently receive and process insurance reimbursements? ACH, virtual credit cards, checks, or other? What do you think is going to be our number one answer here, Brandon? Any thoughts?
To be honest with you, I'm thinking it might be checks.
Okay. We
We'll
got them trickling in here. Give everyone about 10 more seconds to get those answers in. All right. Well, it looks like you are right, Brandon. 40% said checks, 34% said ACH, 12% said virtual credit cards, and 13% said others. So pretty diverse array of answers there.
Interesting. I'll take that correct answer for the win today. Thanks, Jake. Thanks everyone for participating. All righty, next slide, please. Alrighty, so, and I'll kind of tailor the conversation based on that response, right? So a majority of you are receiving check payments for your claim reimbursements today, right? And our goal with not only our straight through processing mechanism, but we have ACH components as well with Zealous. But again, it's to ultimately save administrative time, right? By being able to automate the payment, not only inbound from the payer, but on the outbound, it's taking out any manual effort that's needed to process those payments. In my example earlier, right, with a check payment, there's several steps that you have to take to actually get the money into your account, and not only get the money into your account, but also get the accompanying data posted into your practice management system, right? So now you're waiting for the funds to clear and post, but now you have someone that has to actually take the information from the EOP or the data that was received and accompany it back to the practice management system line by line for that patient's ledger, right? And with straight through processing and as well as ACH, we provide that capability to automate that and take out that manual intervention that's needed to receive the money as well as post it. With this tool, we also provide you with enhanced visibility and reporting directly through our Zealous provider portal as well, right? So not only are we transacting that data straight through to Rectangle software and interface, but we also have our provider portal where you can easily access digital copies of the EOP as needed, as well as download 835 examples also that accompany that transaction. And at the end of the day, each of these items are ultimately reducing paper-based processes, right? So by being able to intake the payment instructions from our payer partners and convert them electronically out to the payments to your provider practices and offices, again, it's reducing the amount of legwork and administrative work that's required to print mail as well as process and post. So again, one area that we definitely want to try and reduce with the technology that we're introducing today. Next slide, please. All right, and as mentioned earlier, right, with the bank posting a check or even with a virtual card, right, you have to take that virtual card if you're receiving it manually and you're keying in that data, right? You have to punch in the credit card number. You have to punch in the dollar amount, zip code, the CVV code, or even the expiration date, right, to actually authorize the payment. And then depending on your batch settlement process, it might take another day or two to actually get the money deposited into your merchant account. And with our consolidated payment system, with our 450 plus payer partners, we have the ability, again, that we're receiving all that information inbound, right, to process all of the claim data from A35 format, or a proprietary format specifically sent straight from the payer. And we're creating the transactions to be distributed electronically, right? So we're able to pass straight through the card transaction to Rectangle, where they could authorize and settle without anyone having to touch a button. So they're essentially getting the transaction information, but not only that, they are receiving the EOP service and claim level detail that accompany that transaction to make posting a lot more seamless, rather than having to focus on a hard copy of an EOP and or virtual card. Now, with the automation of these processes, obviously it's real-time payment data, right? So we are processing credit cards as well as the EOP accompanying information straight through to Rectangle via secure API. So they're getting that information as soon as we process the transaction straight from the payer. So it's speeding up the time. It's getting your money a lot quicker than normally would, as you would receive a printed check through the mail or a printed virtual card that has to be processed manually. Next slide, please. Alrighty, so as far as like greater visibility, right? So I mentioned a lot about the transaction and the funding, but again, all of the data that accompanies that information, we are getting that straight from the payer source system, right? So we are collecting all of the necessary claim information that is needed to post and close out the claim and the full, call it, revenue cycle management process, right? So with our EOPs and 835s that we could provide straight through, it gives you the tools and availability straight from Rectangle's screen to post and close out the claim data for a specific patient. And as I mentioned, right, we also have our advanced provider portal, where if you for some reason need an additional copy of that EOP in a digital format, you can go ahead and log in and download a version of that EOP, which will have even more processing detail tied to that specific transaction that you could allocate based on the payment ID provided through the Rectangle interface. Next slide, please. Alrighty, and most importantly, right, I think the one of the key items here is really reducing risk, right? With straight-through processing, we no longer need to collect, or you no longer need to provide bank account information to additional third parties, right, to receive a direct deposit, right? You're no longer waiting for a piece of mail to arrive at your office, where it could be, again, easily intercepted by a bad actor. With the automation and the data security that we have in place with Rectangle, being able to securely send that information over without anyone touching it, it reduces that risk, not only from a fraudulent behavior, but again from an automated process that makes sure that the data is locked down and secure. And through that automation workflow, it also reduces the potential for human error, right? So I mentioned earlier on the manual processing piece, when you're keying in a credit card, obviously it's a 16-digit PIN and a lot of kind of subsequent data entry that follows. It reduces the error that could potentially miskey the credit card, miskey the payment amount that's associated with the credit card, which then leads to downstream impacts of having to then have a payment reissued or reprocessed, potential reconciliation issues. So by being able to automate that, again, without anyone having to intervene or touch that transaction and getting it straight into your merchant account, it just makes everything a lot more seamless rather, reduces that risk from a security standpoint. And again, we are aiming to improve that efficiency for your practices. Next slide, please. All right, I will kick it back over to Matt to go ahead and walk through the workflow here, and then start getting into the fun details with straight-through processing.
Yeah, Matt? Thank you, Brandon. Great summary of Zealous, and it's exciting to partner with you because on the Zealous side, like you said, you're modernizing, and on our side at Rectangle, we're simplifying. When you bring those things together, you come up with a great solution like straight through processing. So as I framed this up, I did want to just step back and take a 30,000-foot view of the journey that the patient and the provider goes through on the revenue cycle side. Again, patients come in, they present, they pay their copay. We integrate that and post that directly to the practice management system, as well as process the payment. And then way over on the right-hand side, after insurance settles, we can balance bill for the patient, and again, post that to the practice management system. And we've taken that technology, partnered with Zelis, to now post it or process the insurance payment, as Brandon was talking about before. So that orange area you see on your screen, where previously, a patient would make their payment, they would swipe, it would go in, it would process with the gateway, it would settle, and nobody would have to do anything with it. Well, the provider payments work a little different. They come into the office and they stop. So it might be a check that somebody has to do something manually with. It might be a virtual credit card, as we saw in the questionnaire and the poll. But it stops, and somebody has to do something with it to get it to process. So now with straight through processing, it doesn't have to stop. We can automate that last mile, so it just processes by itself. You get paid quicker, and it's less work on your side. So let's go to the next slide, where we're going to kind of zoom in on the insurance process here. As Brandon detailed, Zealous is getting that payment, processing it with the payer, and sending it to you, virtual credit card, check, or however it comes to you. And there's a manual process involved. So you can see we've grayed out those steps that you have to take today, but with straight through processing, you can skip, saving you a lot of time. At the top there of the screen, it tells you, roughly 50% faster. And that virtual credit card comes directly into your system and processes, and the funds settle into your bank account. But also, along with that, you get an EOP. So the EOP is that data payload that comes with the virtual credit card and will now be inside the Rectangle Health system. I'll show you in a minute. But you get the payment processed, you get the EOP in one system, so there's not several different places to look. However, if you ever need to refer back to the original EOP, Zealous has that in that portal that Brandon was talking about, so you'll always have access to that as well. But with straight through processing, we're putting that data, right at your fingertips along with the payment. So now you have the patient payment side, you have the insurance payment side in one spot. And we believe that's a pretty powerful solution. And then, of course, posting it to your practice management system. So with one click, you'll be able to post those insurance payments into your EMR practice management system. Let's go ahead to the next slide. So again, just reiterating the benefits, automatic reimbursement processing. When that virtual credit card hits, it is automatically processed. It doesn't need to wait. A person doesn't need to do any manual steps with it anymore. It goes directly into the system. There's a big increase in time saved there. Importing the claim payment with one click. So with posting is now simplified, because all you need to do is press one button and it posts to your practice management system. And that EOP data is in the same place as your patient payments. And then reducing internal operations cost for providers. Obviously, when there's less manual work, there's more operational savings for you. So again, you can spend time on patient care. Next slide. So now I just briefly want to go through a few screens. For those of you who are already customers using bridge payments, you're very familiar with this screen. This is where all of your patient payments reside. Well, in the same screen now, you will see your insurance payments. All you have to do is use the filter that says Zealous. So instead of just looking at, your balance collect payments, your recurring payments, or your terminal payments, you can now see your insurance payments in here as well. And you can see the same details that you see with your credit card payments for your patients. So if we go to the next slide, if you were to drill in here, you would see all the details, the settlement status, some information about the virtual credit card transaction itself. But the thing that's different now is instead of having the buttons that you would have had for your patient payments, you now see the explanation of payment button. So like Brandon said, and I said before, when you get that virtual credit card payment, the EOP data comes with it. So when you click on that button on the next screen, you'll be able to see the claims that came with that virtual credit card payment. So go ahead to the next screen.
And Matt, real quick, I
Yeah,
think
go ahead.
yeah, just reiterate what your comment on that prior one is. Again, that's a powerful tool, right? So it's not only are we saying that transaction automatically and being able to process it automatically, you're still getting visibility into that transaction, right? It's just not getting lost into the ether, right? So Rectangle has these very seamless interface tools to actually look and reconcile those transactions. So you're still able to keep a good account balance and reconcile and identify all the transactions that have posted and processed to your account there. So
Yeah, absolutely. So they're easy to find, like you said, and you'll also receive an email when we process a virtual credit card payment from Zealous. So let's go ahead to the next slide. And this is where you'll see the claims. So now you're inside of the EOP, which, normally would be a piece of paper or in a portal somewhere, or, somewhere you have to dig through. Explanation of payments come in different formats from all the different payers. As Zealous said, there's, over 400 payers they've partnered with, and everybody seems to have their own format. So when that explanation of payment comes into Rectangle Health, we standardize it. We take that data and we present it to you in a fashion here that's pretty consistent across all payers. So it doesn't matter who the payer is, it would always look like this. And if the virtual credit card had one claim or 100 claims, you would see them here and you would be able to go through them all individually. As you can see here, we have some functionality inside here. This is where you can do your one-click post, which we'll show you a little bit more detail in a minute. We also have a refund button. So instead of having to refund an entire virtual credit card, you could refund just this payment. Although a lot of you are doing your refunds through claim adjustments with the payer, and you should continue to do that. But just know you have that capability here in case you need it. And then last but not least, the claim number. So when you click on that claim number, you can drill into the procedure level details that came with it on the EOP, which are on the next slide. So in here, you're seeing the details of this EOP. Again, whatever type of claim this is, you'll see the line level detail as you drill in. We get these details in the Zealous payload, and you see there's the submitted, the allowed, the deductible, the paid amount, all the typical fields that you need to, at a glance, understand how it paid. Like I said previously, as Brandon said in his part, Zealous has a wonderful portal available if you ever need to go out and see the original EOP. So let's go to the next slide, where I'm going to show an example of the posting. So over on the left-hand side, you're seeing EagleSoft. Again, we can post to any practice management system out there. We've been doing this for years on the patient payment side, and now we're doing it on the insurance payment side as well. And we can post any field that Zealous sends us. So if you want to post the allowed amount, the paid amount, if you want to post at the claim level or the claim line level, you can see here we've integrated in this case with EagleSoft to post at the claim level, the $120 amount, post it on the far left-hand side, and then each individual line posts the payment to the individual line level. So you can see there, it's just one click and it posts over. So I just wanted to show kind of what the user experience is. As you can see, it's very simple. These payments show up in the same spot as your other payments do, and it's very easy to post. You have some other functionality there too. And let's go to the next slide to kind of wrap up the benefits. Go ahead, Brandon.
I just want to comment on that prior slide there, right? So, and then to kind of jump back earlier, right? So each of these claim and service line level detail, it's important to note, right, that Zealous is getting these and receiving these direct from the payer source system, right? So we're able to take that in, reformat it, translate it into our proprietary system, and then ping Rectangle with the API, providing that same data without modifying or adjusting, right? So we're taking the exact claim data that as we're receiving it right from the payer as they would have received it from the provider during the billing process, and we're passing it right through on the API, where you're then able to again post it right into your practice system there.
Absolutely. So again, just to wrap up kind of the benefits, what this means for you. I mean, obviously faster reimbursements, VCC payments are processed in real time. So if you're getting a check today and you want to convert over, let's get you connected to Brandon and we can get that converted over, and then we can flip on straight through processing. Providers receive funds and payments up to 50% faster from Zealous. And when you have straight through processing turned on, it's even faster. Automatic reimbursement processing, again, eliminating all the manual steps to transfer reimbursements. No longer does that payment have to sit and wait for somebody to do something manually. It gets processed directly into the system. 3, faster claim payment posting. So remove the manual steps of downloading the EOP and manual posting. Whatever process your office is doing today, you can replace that with the one-click posting of the claims payment to the practice management system. And then obviously reduce the operational overhead. So the less overhead you have on administrative tasks like this, like we said, Rectangle's on the simplification side and Zealous is on the modernization side. And when you put those together, you can really give back time to the practice to focus on patient care, which, one of the other side benefits of that is employee satisfaction. Employees retention is a big deal today. So retaining those employees with having good practices and good technology is a game changer. And just before we wrap up and go to questions, just to frame this up, we rolled this out last year. So we've been through our beta and our pilot phase, and now we've rolled this out to over 400 providers, and we're continuing to onboard providers all the time. We're getting a lot of interest in this because it is a time saver. It puts all your payments in one system, and it helps reduce that administrative overhead. So, Brandon, I don't know if you have anything else you want to add to that.
No, I think that's perfect, right? So again, we are live with this process today, and again, we always welcome feedback, right, from the actual users, right? So Matt and I are always willing to sit down and discuss any potential enhancements and ways to better the process, right? So it's not always just like a one size fits all. We'd rather get some good feedback from the folks. I think we've initiated some surveys, and we'll most likely do some more in the future here, but always looking to again improve upon the existing product for items that may again benefit your day-to-day processes. So no, I think you covered again all the benefits and what it means for the providers. And again, as mentioned, we're really excited to get some more users on this software here.
Awesome. Next slide, Jacob, back to you.
All right, well, I'm seeing a few questions pour in here. So just a reminder, I did put the link to the demo in the chat. So if you are interested in that, feel free to click on that and sign up. You'll be entered to win one of our Apple Watches. So first question we have here is, are we able to see the reasoning for services not being covered as well? For example, denial due to frequency, missing tooth clause, etc.
Yeah, so that's a great question. As Brandon mentioned, we're always looking for, feedback on how to improve it. And that's an actual enhancement that's already in progress. Zealous is working hard to include that in the payload data that they send us, and we'll be incorporating that in the user interface in the very near future. So you'll be able to see those remark codes and that data that tells you why it paid what. Right now, you can see the paid amounts, you can see the deductibles, so you have a pretty good idea, and we'll be adding more data very soon here to improve that patient experience even more. And like I said, at the end of the day, as Brandon mentioned before, they have a wonderful portal that you can always go back and see the original EOP if for some reason you want to see the original.
Absolutely.
Cool. Are EOBs saved for at least 7 years in your system for providers to look into?
They are, yeah. So from Zealous' provider portal, again, they are saved. Actually, I think a little over 7 years, right, for all payment history, right? So if you have an account and are being paid through one of our payer partners today, and receiving transactions through our software, and even with the straight-through processing with Rectangle, we will store that EOP data in the portal for, again, you could open it up on screen just for ease of view there, or you can download it directly to your desktop for archiving.
Cool. Does the EOB specifics from a paid claim save to the patient's chart within the practice management or Patterson Fuse?
Yeah, so we can post to any practice management system. So with our scripting technology that we've been using on the patient payment side for years and been able to integrate to any system, we can do the same on the insurance payment side. So absolutely.
Cool. How does the software handle downgrades?
So I think this might be a question more on your side, Brandon, because we're posting what Zealous is telling us to post. So this would be more of a claim adjustment, it sounds like. If I'm understanding the question correctly.
Yeah, I might not be understanding the just terminology the downgrade terminology there, but again, just to reiterate, the data we're receiving is straight from the payer's 835 source system, right? So they're giving Zealous the instruction and all the required detail on who they're paying on behalf of the insured, et cetera, the patient. And we're essentially we're translating that information, creating the proprietary output, and then calling the applicable APIs out to Rectangle to send that detail, right? So if there's any adjustments that happen prior to the payment, that's all being handled upfront on the payers, and where we're on the payments component from Zealous, we're essentially ingesting that data as is, compiling it, and then distributing it to Rectangle. Hopefully that answered the question. I'm again wasn't as familiar with what they meant by downgrading, but.
Cool. Thanks, Brandon. What makes this solution better or different than others in the market right now?
Well, I think just on the surface, just doing the straight through processing in our partnership between Zealous and Rectangle is unique in the marketplace right now. And, pushing it straight through, like I said, most insurance payments get to the provider's office and they stop, whether it's a check or a virtual credit card. So being able to push that straight through without any human intervention, speeding it up, taking away those administrative steps. To me, that's what makes it unique. And Brandon, I'll let you add or confirm that from your perspective.
Yeah, absolutely. I know the term might get thrown around a lot, and others might have tried to accomplish it, right? But it's more than just providing the transaction, right? The whole healthcare life cycle and posting process is much more sophisticated than just getting a dollar amount or something deposited into a bank account, right? So it's not only just being able to send that transaction without anyone having to intervene or manually post and process. It's essentially being able to deliver that accompanying data with it, right? So you're not just getting a blind transaction deposited to an account, you're also getting the underlying and supporting detail, again, driven straight from the payer source system that accompanies that transaction, again, tying all the pieces together to make that posting and claims closing process much more easier and efficient.
Are you able to do bulk texting? I tried it some time back with another company, and it was a very manual and painful process. Can you talk a little bit more about bulk texting?
Yeah, so on the Rectangle Health side, we do bulk texting, so we can get that the list of patients to pay from your practice management to request payment from your practice management system, send them a link to process them. And actually, if you're following Rectangle Health, we are going to have some upcoming webinars on bulk text to pay. So stay tuned for that, where we're going to go into a lot more detail on that side.
I've got about 5 different questions here about fees and credit card fees versus provider fees and what percentages are and all that. Matt, you kind of just want to take that and just summarize in terms of fees. Is there a fee to Zealous? I'm seeing I have like 7 or 8 that are all variations of similar questions here on fees.
Yeah, I mean, there's definitely processing fees related to virtual credit cards. But remember, when you convert over, it's saving you a lot of steps. It's processing a lot faster. A lot of the payers are migrating to this. So if you're moving to virtual credit cards, you might as well turn on the straight through processing component, because that card is having a processing fee anyway. So you might as well turn on the straight through processing to take advantage of those other time savers and reducing the administrative cost as it comes into the system. And just knowing, like Brandon said, there's a security element involved. You don't have to expose any of your banking data. You don't have to have these transactions out there or have paper floating around in the mail. Virtual credit card is very secure. It's encrypted, and it doesn't expose any of your personal data. So converting over to it, it just seems like the direction is, going more and more in that area. So turning on straight through processing is just a complement to that and taking advantage of the technology that's there to push it into the system automatically. So I know that that's not a specific question, but we would be glad to talk more about that if you'd like to reach out to us and are interested in converting over.
Yeah, and just to add to that too,
Yeah.
once we're done with the Q&A here, I'm going to show a slide that has our special offer. And once again, if you hit that demo link, our team will fully walk you through our different fee structures and what that all looks like. So one more question here on fees and costs. It says, is there a cost per payment posted?
There is not a cost per payment posted. Like we said before, there's the transaction, and obviously you would be already a customer of Rectangle Health and Zealous. So if you're already using virtual credit cards, you're already paying that fee. And if you're converting over from check, you're getting all the benefits of consolidating those processes and making the payment come through a lot faster, not exposing any data, and on the security side. So there's not an additional charge per transaction per se.
Perfect. I'm going to do 2 or 3 more here. We have a bunch of questions. So if we don't get to your question, our team will be happy to answer them on the phone later today or via email. So how does the software handle large volumes of payments? Does the software maintain same quality as the payment volume increases?
Yeah, our system is completely scalable. I know Zealous is too. So as your volume goes up, we have some people receiving just 1 or 2 virtual credit cards a month. We have some people who receive virtual credit cards every day. So it is able to scale, and you can see all your payments, in that transaction report in a very organized manner. So Brandon, I'll let you speak to the scalability on the Zealous side, but yeah.
Yeah, no, you hit it right in the head, right? So it's nothing from a volume perspective will bog down the process, right? It's not going to delay transactions getting over to you, right? So the amount of transactions that Zealous processes on a day-to-day basis is quite significant. So switching over to straight through processing essentially just reroutes how that virtual credit card is delivered, right? So it bypasses that print or fax stream and then just calls a direct API with Rectangle, which again, volume unrelated, right? It's still the same process from a timing perspective, and it is very scalable across the board from all provider practices. So.
Is there a way you can be sure claims are being processed on the correct fee? For instance, if we participate through a third-party payer?
Interesting question there. So I'll try to take a stab. So from Zealous's perspective, when we create the card transaction, as Matt mentioned earlier, right? It's really just the per transaction fee that gets assessed, right? So when a credit card is processed, even outside of healthcare, right? If anyone that uses a credit card with a standard merchant or retailer, right, there's a processing fee that gets assessed there. So that fee does not change based on the type of claim that's processed, if that's what's being asked there, right? So It's that standard kind of percentage-based fee that just comes along with the standard card processing, as well as the again, the security benefits, et cetera, that follow the kind of automated stream there.
Perfect. All right, I'm going to do one more question and then get into our closing here. But great questions, and thank you everyone for your participation. This is fantastic. So, if there's a patient responsible portion, does Rectangle Health and Zealous send a message directly to the patient, or does our office reach out to the patient to collect the remaining balance?
That's a great question. So once the insurance payment has processed and has been posted to the practice management system, obviously there could be a remaining balance, via integrations, which vary across PMS in that case. We could get a bulk text to pay upload file from that practice management system to collect the remaining balances. So there is a degree of automation there that happens after the patient insurance payment has settled. Again, kind of helping through the entire journey. And I think that's what the most exciting part is now that we're getting these insurance payments in. We are really, moving the patient through that entire journey from the initial copay to the insurance payment, and now collecting that remaining balance with our integrations to your practice management system. So yes, we can automate that last part, which again, I'm sure we'll be talking more in our bulk texting webinar coming up soon.
Great. Thank you guys for your answers on those questions. And once again, if we didn't get to your question, our team's going to be following up. So don't hesitate to ask them as that happens. So just a few quick things to round us out here. We do have a special offer. We had some conversation about rates and fees. So we are doing special for this webinar, the first month of the Zealous fee waived. So that's a great thing to take advantage of there as well. And then we're also doing payments rates starting at 1.89%, really great competitive rate, probably about as good as you'll get anywhere you find. And then those rates vary based upon different packages and things like that. So awesome stuff there. Once again, take advantage. We have a demo link posted in the chat where our team will follow up with you and you can take advantage of those great rates. And another great reason to do that is because today was all about the gift of time, putting time back in your days. So we're giving out 2 Apple Watches. We had great participation. I think I saw 85% of you participated in the polling, which is about as high as I've seen in a long time. So great work there for all of you who did that. You're automatically entered to win an Apple Watch, and then you'll also be entered to win if you fill out that demo request and then sign up and complete a demo before June 28th. And then just to kind of close out a few housekeeping notes here, we are going to be sending out a link to the recording. So if there's anyone from your practice who couldn't make it that maybe deals with some of the claim reimbursements, definitely pass the link to the recording along to them. And then also we'll have the slides available to you as well. We're going to have that survey pop up at the end. Let us know how we did. We're always looking to improve. I'm seeing some great comments already coming in for you guys, Matt and Brandon. So I think you did pretty good, but definitely provide those comments so that we can continue to learn and grow our webinar program. And then if you have any questions about anything that may come up, don't hesitate to reach out to us. We're here to help however we can and assist your practice. So with that, thank you all so much for being here. We're going to get you out a few minutes early. And Matt and Brandon, thank you so much for your time. Really great presentation. And everyone have a wonderful rest of your day.
Thank you, Jacob. Thank you, everybody.
Thanks all. Have a great day. Take care.
Bye.